A report by the United Nations Population Fund has found that people of African descent in the Americas are prejudiced in various sectors. They mainly face systematic racism and sexism, in particular in the health sector. The report also reveals that women are mostly subjected to verbal or physical abuse as well as denial of quality care. Patricia da Silva is the program advisor for UNFPA's Initiative for People of African Descent. Thank you very much, Patricia, for your time this morning where you are. Let's start with how the report was conducted.
Yes, good morning to you too, Dudu, and happy South African Women's Day to you and your colleagues. Yes, so the United Nations Population Fund, it is the United Nations agency that focuses on sexual and reproductive health and rights. And indeed, we are a global organization. We are a data organization. We work in over 150 countries in the world, and we do work tirelessly to ensure that we prevent maternal death by 2030. We also want to ensure that in doing that we leave no one behind. And like you just mentioned, unfortunately, women and girls of African descent continue to face multiple and intersecting forms of discrimination. So with the awareness of these disparities, informed by the Agenda 2030 principle of no one behind, also supporting the implementation of the program of activities of the International Decade for People of African Descent. We do have an initiative for people of African descent right here at UNFPA, which amongst other things really looks to raise the availability or to increase the availability of data and evidence that is disaggregated by gender, but also by race and ethnicity. And so what we have found in these past few months is that maternal mortality rates stopped improving. In fact, they have either stagnated or worsened in most regions of the world. And so this analysis really wanted to look deeply into the root causes of the disparities of maternal health outcomes for women of African descent. We wanted to understand also how it is impacting them and what is it that we can do to actually change this scenario. The reality is that the highest standard of health, including reproductive health, it is a human right, and this is a human rights crisis.
And so what are some of the root causes when you speak of maternal health outcomes which are not looking good?
Unfortunately, you are absolutely right. They are not looking good at all. So what we did is we analyzed data from 9 countries, and those include U.S., Uruguay, Trinidad and Tobago, Brazil, Colombia, Suriname, Costa Rica, Cuba, and Panama. And we explored data for 5 indicators. Of course, maternal mortality, as you mentioned already, access to family planning, access to prenatal and antenatal care, access to skilled birth attendants, and also, I think I already said adolescent pregnancy actually is the 5th one. So what we found is extremely unjust, it is outrageous, and really it is unacceptable. First, the sad reality is that Black women's bodies in the Americas have been abused, attacked, disrespected, neglected since the times of enslavement. So we're talking about unauthorized medical experimentation, we're talking about rape, we're talking about neglect. So what we found in this analysis is that structural racism and sexism really drive these maternal health disparities. And the racism and sexism really is a key barrier to achieving the highest attainable standard of maternal health for women of African descent. And just as importantly, these disparities exist across income levels and across education levels. And that's a really important point. And you also mentioned in your introduction that women of African descent disproportionately suffer what we call obstetric mistreatment. And that is being yelled at, being ignored, not being able to see the doctor on time, longer wait times in waiting rooms. We are talking spending less time with the doctor, just disrespect, disregard, abuse, both physical and verbal abuse. Another issue that we also found, of course, is that raising inequalities across the Americas also have a compounding effect in these maternal health outcomes. And just one last point on that is important. There are several, and I invite your viewers to look at the report. But one last point is that is really important is that we really need data, and what we found is that there is not enough data disaggregated by gender, race, and ethnicity available.
It would sound in a nutshell that the root causes are systematic. And so the report, Patricia, points out that the crisis of maternal deaths has intensified over the last decade in the Americas. When you look up the synonym for crisis, you find words such as catastrophe, calamity, emergency, disaster, predicament. And so given that this has been going on for a number of years, in fact, so these kinds of reports, what then is the point where year in, year out, nothing changes systematically? So we have another report, and then what?
That's such an important question and a very important point, and I'm really glad you brought it up. Look, like I said before, one is we cannot solve what we can't see. So we commend the countries that are already disaggregating data by gender and ethnicity, but we really, race and ethnicity, but we really need more countries to bring us this data, to develop this data so that we can really understand. Because also, I mean, I talked to you about the findings generally, but they're also very contextual, right? So there will be nuances depending on which country, which region, or even sub-region you're looking at. So we need that data. And then we need to continue to advocate for these changes that we're recommending in our brief. And that, of course, in addition to the data, includes, for example, ensuring that there is systemic change within the health system, including within the maternal health system. So policies that really are more inclusive. Clinics, hospitals, maternity wards, they need to be safe spaces. The health system need to establish policies to end obstruction treatment that includes verbal and physical abuse. We need the medical education system to really get rid of these racist ideologies in their training curriculum that still persist with ideology from slave era beliefs about black women's bodies that really cause death. We want to ensure that we are increasing the representation of women of African descent, doctors, obstetric nurses, midwives. So we need to continue to work that. As you might know, UNFPA trains midwives, and this is something that we really put a lot of focus on, ensuring that we're training them, but within those communities so that they can work within their communities that they understand better than most as well, and also the lived experiences of their communities. Some of the issues that we have are also systemic. We're talking about inequalities, right? For example, access to universal health coverage, health insurance, to put it more simply, right? So we need to ensure that we have a system that allows a woman, no matter what her condition is, to access the highest quality of maternal health. So we're going to continue to work with our partners across the globe to ensure and continue to advocate for these changes and support them, including in the disaggregation of data, but also in these policy changes.
Thank you very much, Patricia da Silva, Program Advisor for UNFPA.